In today's video, we're going to be looking at some of the data that showed some of the longest duration of the spike protein in our cells, and that's both post-infection and vaccination. But the reason why I wanted to show this content is more from the point of view of a really interesting proposed theory of how to treat long COVID or vaccination related injuries, such as we're referring to like post-vaccination syndrome. This is specifically a work of this one individual that's spearheading this, and this information came out in the past, but not too long ago. This individual is certainly happening to grab really big attention for showing how long spike protein can be found in some of the immune cells, and that garnered a lot of attention. But for me, much more interesting is this idea of a very interesting proposed treatment, and we're going to get into details of all of this. And right now I am trying to see, that's one of my areas of focus, trying to see what does the science say about how we could potentially be helping individuals that are suffering from spike protein related injury, what maybe we refer to commonly as either long COVID or post-vaccination syndrome. Now, this article, one of these articles specifically talk about vaccine injury, and they mention, look, this can show up very rapidly and last for a long time, and the symptoms are very similar to long COVID as well. So we don't even have a terminology straight yet, right? But obviously scientists are talking about these things. All right, so let's get started. My name is Dr. Mikhail Rashik of Neurogenomics. And let's get going. And I guess maybe I'm a little nervous about this video if I cannot even pronounce my own name. So this, what are we talking about here is that this individual is saying, look, clearly post-vaccination, there's people who have symptoms that are very similar to long COVID. And not long ago, this group of scientists, I believe it's spearheaded by Dr. Bruce Patterson, showed that certain immune cells can retain spike protein for about a year and a half after infection, and specifically in a type of our immune cells called monocytes. And in that publication, when they released that information, they said, we believe this is due to infection, last acute infection, and not reinfection, is because there was a documented infection, and then they also sequenced the genetic material of these monocyte cells that had the spike protein, and they were only able to show fragmented versions of the virus genome, nothing intact. And that's what led the authors to believe that these monocytes indeed managed to retain the spike protein for this length of duration. Okay. So now let's maybe break down a little bit what are monocytes. So monocytes are built in your bone marrow. They're released into circulation. And once they're in the circulation, eventually they will differentiate into either macrophages or dendritic cells. And you've heard me talking about these type of cells many times. So both of these cells, they have these phagocytic abilities, meaning they can literally swallow up a pathogen, something that is attacking you, or rogue cells that are not behaving normally, our own cells. So they have that capacity. That's called phagocytosis, literally just like you swallow it up and then that can be destroyed. Now, macrophages, these are immune cells that reside in our tissues. Once monocytes leave the blood, they can then differentiate into these macrophages that can penetrate tissues and reside in a tissue and literally just maintain it, that it's clean from either infection or anything going wrong, such as, say, cancer development, right? Dendritic cells, they also can swallow up pathogens and so on, but their role is slightly different. They are expert at presenting antigen, and remember, antigen is a fragment of a pathogen that is then presented to our immune system for recognition and for mounting attack. And dendritic cells are expert in doing that, so then they travel once they swallow up the pathogen, they can then travel to the lymph tissues and lymph organs where they do present these antigens to the immune system to be like, hey, this is what's going on in the body. We need to be responding to this say problem. Okay, so that's what monocytes achieve. They eventually differentiate into these two type of cells. But here's the interesting part: these monocytes typically have a super short lifetime before they start differentiating. Literally, it's 1 day, maximum few days, right? And what these authors posit is that these monocytes that have spike protein in them, they can now survive much, much longer. And hence, the authors believe that those monocytes that had spike protein in them a year and a half after that's the longest one that they observed, after the acute infection, then this is how long these monocytes are now surviving. So they have this extended lifespan that lasts months and even years, something that is actually not normal. So, however, and I'm like, of course, like, wait a minute, seriously, you go from just this super short lifespan to this super long lifespan? But apparently, yes, it can be done, and it is observed in real life. It can be done in a laboratory setting, so you can take your monocytes and extend their lifespan by manipulating them chemically, so with chemicals that you might be observing in our own body, natural chemicals. And this is also observed in certain conditions such as rheumatoid arthritis or irritable bowel disease. These monocytes can also have extended lifespan. So it's not a foreign thing. It does apparently really happen. So this is obviously really interesting then. And the authors wanted to find out, like, look, is this also happening post-vaccination? And this is the recent paper that came out, had a bombastic title not long ago that said, hey, look, you can have spike protein in these monocytes for 255 days post-vaccination. That was the longest time span that they basically measured. So again, we're talking about these monocytes that are living for much, much longer time. So that's what they wanted to do. They wanted to confirm what we have observed in long COVID patients. Are we going to be seeing also in vaccinated individuals that are showing these post-vaccination syndrome symptoms? So they took 50 people who were vaccinated and had symptoms. I'm just going to call them long COVID-like symptoms, okay? And they measured their symptoms, and indeed, like, when you look at what their symptoms are like, they're very much what you would normally see with long COVID, right? So, and on average, these are people, I believe they were on average maybe 100 days after their vaccination. I think the shortest was maybe around 40 days. The longest was 245 days. And as you will see, they obviously managed to show spike protein in the monocytes of an individual who was vaccinated 245 days prior, and this is why they had that time spent, the longest time spent. So, we're looking at 2/3 of a year type of thing. And they juxtapose that with 45 vaccinated individuals who didn't show any symptoms. They were just fine. And they didn't care which vaccine people took. They looked at any vaccine, any COVID-19 vaccine, as long as you showed these problems. And the first thing they did is they look at these panel of cytokines and chemokines. These are the type of chemicals or molecules that our immune system is using for communication and execution purposes. And they looked at it specifically for this 14 because previously they were able to show that these 14 were capable of differentiating long COVID patients from those who just simply had mild or severe COVID. And so they repeated that, and this is where I was not really convinced with the data. They claim, like, look, these vaccinated individuals do fall into the category what they observed previously with long COVID patients. I didn't really see that. I saw that it's more in between both the benign and severe COVID and those who had long COVID. But the authors claim that they seem to be following the long COVID pattern. All right, but out of those 14 chemicals and molecules they tested, 4 of them were statistically significant elevated in a statistically significant manner in the vaccinated individuals in comparison to the controls, and that was interleukin-6, interleukin-8, this chemical called CCL5, and another one called soluble CD40L, something like that, or maybe L1. And we'll get to these in a moment. All right, so then they showed that, and the next thing they did is they took a bunch of these vaccinated individuals and they started to look at specifically at their monocytes. And I believe they took 14 vaccinated individuals versus 10 controls. They isolated those type of monocytes, and they showed that specific types of monocytes did indeed have spike protein in them in comparison to controls. And now I'm gonna tell you there's three types of these monocyte cells. They're called classical, which are about 85% of all monocytes are referred to as classical. These are the guys that have that phagocytotic abilities, the ones that can do that phagocytosis, and versus two other ones, non-classical. These are the ones that they look at your endothelial tissue, so your blood network, to see if it's all being fine, and those are called non-classicals. And then there's also intermediate ones, which can do a bit of both. Okay, and you can differentiate these monocyte cells by what kind of molecules they express on their cell surface. We're gonna ignore that component. The only reason why I mentioned that is because they showed that it's the non-classical and the intermediate monocytes that have the spike protein, that had this spike protein in them. All right, and they were able to show this, that and they were literally looking for a spike protein with selecting for these cells using spike protein antibodies, and they were able to clearly show that these individuals that they chose to test, there was statistical significance of spike protein being shown in these monocytes, non-classical and intermediate monocytes, in comparison to controls who did not have any symptoms. So then they took a bunch of these cells from a few of these individuals, and they went after the spike protein, and they broke it apart and into fragments, and they were able to look at these fragments, what they are, to show that there is indeed literally spike protein in there. And they were able to show that, and they actually gave us the list of the fragments. And here is the only big issue that I had with the article, is that the telltale fragment of the vaccinal spike protein that would prove that it is indeed from vaccine, that was not there. Because remember, the COVID-19 vaccine spike protein had introduced specific mutations where natural amino acid that is normally found in the viral spike protein was replaced with another type of amino acid. Amino acids are the building blocks of proteins, and these two amino acids that were introduced in the vaccine spike protein, they were prolines, and they're introduced in the vaccinal spike protein, so that that spike protein cannot do its normal function, because it would be bad then, because that normal function is to be able to fuse virus with cell, and you don't want to have spike protein on the surface of a cell and then start fusing with other cells. That's what happens with post-infection, but you do not want to have that post-vaccination. Hence, these proline amino acids were introduced into the vaccinal spike protein, and you can identify the vaccinal spike protein based on looking on that specific fragment of the spike protein that has those proline amino acids. I did a video on that showing that indeed vaccine spike protein can last in the circulation for a very long time, and this is exactly how they were able to prove that, using that specific fragment. These guys that I'm talking about, the group of Dr. Patterson, they didn't see that. So you cannot rule out that what they're isolating in these monocytes, in these vaccinated individuals, is perhaps is due to infection. So they could not rule that out, and they do admit that that's a limitation of their study. So that's my only weakness of the study. But nevertheless, they clearly show that there is spike protein in these monocytes, and they believe that these monocytes are surviving for a very, very long time. as a consequence of the spike protein, and is now a contributing factor to the problems that we're seeing in either long COVID or the post-vaccination syndrome. And why is this? And the reason why is because these intermediate or non-classical monocytes have specific type of receptors on them. And these receptors can be used to allow these monocytes to attach themselves to the endothelial cells. So remember, endothelial cells are the type of cells that are used to build your blood vessels. So your blood network vessels are made out of these cells. Monocytes can be recruited to a site of injury. So if you have inflammation, you can have injury, you can expose. They actually said, look, you can, when you have the injury, you can expose collagen to it, and then platelets will come into the site of injury. They can bind, these platelets can bind to the collagen directly or indirectly via von Willebrand factor. Once platelets are attached to that area outside of injury, they are activated and they can also proliferate. And once activated, they can release a bunch of chemicals. One of those chemicals is CCL5. Remember, we mentioned that's one of those chemicals that was observed to be elevated in the vaccinated individuals that show symptoms. So this one of these chemicals can act as a chemoattractant to call the monocytes to the site of injury. All right, so that's one of them. And monocytes have a receptor for that specific chemical called CCR5. So then R stands for receptor, L stands for the ligand. Ligand is anything that binds to your receptor of interest, okay? So that's one of them. Another chemical that can be released as well is it can lead to exposure of this chemical called fractalkine, I believe. It's the other name for it is CX3C, I believe, L1. Now CC stands for cysteine, X3 means 3 amino acids between those two cysteines, and then L stands for ligand, R stands for receptor, and then monocytes have receptors for it, which is CX3CR1, right? So the receptor for that fractalkine chemical. So again, it calls for the monocytes to come to the site of injury and interact with these endothelial cells. It can be good, but if there can be process of perhaps fixing things, but the problem is when there is too much of something. And this interaction between this CX3CR1 receptor with that fractalkine molecule on endothelial cells, that has been known to be a problem in, say, issues such as atherosclerosis or issues related to your blood network, so inflammation of your blood vessels. So the authors posed, listen, this is perhaps how you might explain this endothelitis, which is inflammation of those endothelial cells of your blood network that can be seen as well in post-vaccination, right? So perhaps it's this recruitment of these monocytes to the blood vessels. Why is that a problem? Is because when you do this and you have this overreaction, overall, you also will induce coagulation, right? And which is clot formation. And so here is yet another potential indirect way how spike protein could be contributing to those clotting issues that have been observed in the past. I did a big series where I mentioned how spike protein could be directly involved. I gave you other two videos where I already showed you a couple indirect ways. One was via autoantibody production. Another one was via involvement of the bacteria. And here's another third one, via allowing these monocytes to live too long, and therefore they can now damage the endothelial cells as well. And why these monocytes potentially live so long while they have the spike protein, Who knows? That's not wasn't answered in any of the literature that I read by these authors. What would be that connection? But they claiming, look, this is what might be the problem, and we need to fix that. And there is a way to fix that, because and that's what they propose. And this is the part that is really, well, I thought was really interesting, because not only did they propose a treatment, they already did a study of that as well, where they treated a bunch of patients with their proposed treatment method. Unfortunately, that paper is not peer reviewed, but let's go over it really quick anyway, because it's really, really interesting. Remember, we don't have yet any explanation, official explanation, as to what's causing either long COVID or post-vaccination syndrome, and we definitely don't have yet any approved treatments for either one of these. So then science is always going to be the first one that is going to give you any suggestions as to what might be going on before medicine figures it out. So science always will come first, and then medicine will see what the science does, will expand its studies, and then we finally figure things out. So worthwhile to see what's coming out right now. And what these guys were proposing is use 2 drugs. So drug number 1 was an antagonist of the CCR5 receptor, so the receptor found on these monocytes. And it's an antagonist, I'm not gonna remember, I think it was something like Miravac, but it's a drug that is already approved for treatment of HIV, precisely for that, to prevent that interaction. Oh, they also mentioned that these, I think they were mentioning that these monocytes can cross blood-brain barrier, and therefore can also cause neurological issues that we might be seeing as well. All right, so that's one medication they proposed, and the other one is statins. And why statins? Is because we all think of statins for dealing with your cholesterol, but statins can also increase or decrease expression or production of that fractalkine chemical that I was telling you about, the CX3CL, I think 1 was, or maybe it was just L, that fractalkine. It will reduce its production, and therefore it will prevent, again, calling the monocytes to come to the endothelial cells via that route as well. So they actually use this dual drug combo to treat 18 patients, long COVID patients, and they measure these patients from a variety of different angles. So they look at heart performance, they look at neurological performance, the autonomic disease conditions as well, and fatigue as well. And basically the take-home message is that in their small study, it improved all of those scores for these individuals between 6 to 12 weeks using that dual drug combo. So really, really interesting results as well. And another chemical I forgot to mention is that when platelets are activated, they also release that soluble CD40L chemical, which is also observed in the vaccinated individuals. That also brings monocytes to the endothelial cells. So the reason why I remember that is because one of the things that, remember, was also observed higher in the vaccinated individuals that were showing symptoms was interleukin 8, and when they were treating these patients with this 2 drug combo, they showed that reduction in the interleukin 8 correlated with improvement of the cardiac performance as well in those individuals. So very interesting information. Clearly we need more studies. I keep saying that for every long COVID video that I make, but that's what we really, really need. We still haven't had any major studies. So yeah, very, very interesting stuff. The only thing is that for one of these drugs, it has a black box warning for potential toxicity to your liver. So they were observing their patients for that purpose, but I believe everything was fine for the duration of the study. All right, I'm gonna wrap it up here because the video is getting a little bit longer already, but just trying to basically, my goal is to give you soon coming up an overarching summary of what I know about how are scientists looking at long COVID from every different angle, and this is just one of the videos that is going to add to this summary. So stay tuned for that, and please give us a like, please subscribe to the channel if you haven't already. Please check out our Patreon account as well, which we provide extra information that doesn't make to YouTube. And most important, please go outdoors and enjoy Mother Nature to stay as healthy as possible. And I look forward to seeing you soon. Bye, everyone.